Morning, everyone. It's
大家早上
another
好。
Sunday morning. At the same time, it's on the 10th day of Chinese New Year, right? 年初十啊。
对了，今天是年初10，十全十美。是的，我们希望都能够达到十全十美的人生，虽然是有挑战的了哈，可是我们还是要有这样子一个信念，对不对
？As you seek for perfection in certain context, 你可以十全十美 right? Not as in the cross, but rather completion in a sense.
到最后，你先要有这个十全十美的概念跟这个信念。那可能你在人生当中，你只做到9全9美、7全8美、6全7美，我觉得都 OK。
When you say 全 is 拳头的拳是啊，还是
全是完全的全？
哦，
全部的全。
OK， 不是全。
我给你10拳。你要我给你10拳吗
？OK 啊。
哇！我给你10拳可以。
OK, I'll become all my cut after that.
啊，我还会煮这个10拳大补汤给你。
Oh, OK, thank you. That would be nice.
这个10拳大补汤是10拳啊，拳是全能的全啊，哈。OK， 不是拳头的拳。
Completion in a sense.
Yeah， 今天呢，我们是邀请到了我觉得他应该是蛮年轻的，虽然我不知道他真正的岁数，可是刚才听他就是聊他自己的背景的时候，还有他的专业的时候，我这样子推算一下哈，他应该只不过是30几岁，所以我是觉得他应该是年轻吧。
I don't remember how young he is. He's our special guest for today. So later maybe you can ask him. He looks maybe he looks like he's in his mid-20s 啦。
他是脊骨，脊呢就是脊椎的脊啊，我们的脊椎啊
，spinal cord
对，脊骨神经医学，他是读这个脊骨神经医学的。那所以今天大家如果有跟什么背部的疼痛啦，甚至你觉得就是任何一种疼痛啦，可能你可以问，就是可以问一问，然后我们的 Dr. Theo 呢也会尽量的在接下来的1个小时呢能够回答的，他都会尽量的回答。那尤其是跟背部、跟这个颈椎啦、胸椎啦、盘骨啦、这个范围的一些疼痛有关的，都可以问我们的这个 Dr. Theo。
Yep. So I'll be bringing him in, and then I'll give a quick, brief introduction about him first. Dr. Theo was born and raised. Yep. Do help us like and share, correct?
Yeah, 帮我们点赞，那还有 share 出去。
Okay. So as I was saying, Dr. Theo was born and raised in Northern California near San Francisco, receiving his chiropractic care at the age of 14. That inspired him to look into chiropractic or find a profession that had to do with people transforming their life. He received his formal education in the US and earned his doctorate of chiropractic at Life Chiropractic College West in California. And after contemplating between working in US, Europe, and Asia, he eventually chose Singapore. So since 2008, he has been running his own practice, Life Chiropractic, and his practice focuses mainly on human development, which includes care for infants, children, pregnancy care, elderly care, and of course the average office worker still sitting in front of a desk most of the time. He considered himself a seeker of truth, which leads to an interest in human development, consciousness, philosophy, science, and technology, and even religion. Because the mind and body is interconnected, so he will be the one who will give us more insight into what is pain and why we have pain.
可是 Dr. Theo 他也强调了，他是一个追求真理的一个医生 about truth.
The one who seeks truth. All right. So let's welcome Dr. Theo. Hello, Dr. Theo. Welcome to our show.
Hi. Hi, everyone.
Good morning, Dr. Theo.
Good morning. It's great
Okay,
to
just
be
now I
here.
mentioned that I counted, when you started chiropractic, and then, how long have you been in this profession? I sort of, came up with, you are still quite young.
Yeah, he's only 20 years old only. Actually, how
I mean,
young are you?
40. I'm
Oh,
40.
okay, that's
okay.
great. Still young.
That's considered young, younger
Yeah,
than us.
you're younger than us. We are in the 5 mark. He's in the 4 mark, so it's still young.
Okay, actually, I'm very curious because although we have chit chat a little bit, you said you have started, you have gone through chiropractic at the young age of 14 years old, and that actually inspired you to when go ahead for this profession as a chiropractic, right? And what happened back then?
Um, it was more of a intuition. In fact, the chiropractor that I was going to wasn't that inspiring, but I basically saw her because she was recommended after we got into a car accident. My
Mm,
cousin got rear-ended, and I had a whiplash injury, and my neck was sore for more than a week. So
Mm.
after being so sore and feeling kind of physically devastated, I got chiropractic care. And within a short amount of time, I got better, and I underwent care for about 3 months. And by chance, my older brother happened to go to chiropractic school. He started like his first quarter, and he felt so inspired and motivated. And I think that pushed me even more.
mm.
Um,
Uh,
So,
yeah, I
what?
was,
How
yeah.
serious can whiplash become?
Anyone that gets into a car accident and does have whiplash, or even whiplash getting in any kind of accident, there could be a lot of damage in the ligaments.
Mm,
And when the tissues heal, and this is not just only in the spine, but this is anywhere in the body. When
mm,
the tissues are healing, it's very important to restore the normal function of that area. So whether you sprain your ankle or whether you injure your spine, someone like a chiropractor
mm.
can help you
I
with it.
totally agree with
Yeah.
you, and I can relate to that for the past 3 months, because I only hurt my little toe on my left foot, and it's
Left.
just one toe, left left foot toe, and I went to a normal doctor, and then they don't seem to find what happens to it. We took an X-ray. They said
Uh-huh.
they just give me Panadol, painkiller, and then they say, oh, maybe it will go away. But after 1 month, it still doesn't. It's swollen. It's swollen, and then my friend introduced me to physiotherapy,
Mm,
Hmm.
and that's when I start to know that, because I got this ligament torn, and then that's where I also know about like what Dr. Tu had said. After you have the scar tissue, how the scar tissue actually, evolves, and there is stages of the scar tissues, and you got to do something to it. If not, like for example, my fat little toe, it will stay at that size if I do not do anything to it, like to
Right.
press or do massage on the scar tissue, and it actually moves. And I literally see that scar tissue being pressed to other
Hmm.
parts of my leg.
mm.
Then
Yeah.
that's why I said I can relate to what Dr. Theo said. When you have scar tissue, you got to do something to it
Mm.
in any parts of the body.
Yeah. Yeah, it's quite common that people go to a medical doctor, and that's when the medical doctor nonchalantly tells them things are fine. And it's not their fault. Um, when they're educated in school, they get, excuse me, they get an over glorification of what they actually do. And when they're in medical school, they believe that medical doctors are everything. All aspects of health and well-being, they are the primary healthcare physician. Therefore, they're supposed to know everything. And most of the time, they're often the best students, especially in Singapore, the best students that are in school, in secondary school. So it's very easy for them to have this unconscious superiority complex. And, individually, doctors don't feel and think this way. But I think on a macro level, the profession thinks this way. Like the whole body of medical doctors. And, certainly medical doctors are a very important element of our life. I mean, they're often the first people that help us deliver our children. And they are also the people that take care of our parents when they're older. But a lot of things happen in between being born and dying. And that's when things like physical therapy, physiotherapy, chiropractic, meditation, yoga, acupuncture, these things excel in elevating people or restoring health back to normal.
Okay.
And, to begin with, medical doctors are licensed to treat and diagnose disease. So if you're not dying from something, they often can help you out.
So our question for the general public is, why does pain exist? Can you share with us more about it?
Well, on a very obvious level, pain exists as feedback to the body. I mean, there are some people that have a disease. I already forgot the name of the disease, but basically they can't feel pain at all.
They can't feel pain at all.
They can't feel that their hand is burning. They can't even feel if they break an arm. So, pain helps us. It basically prevents us from receiving severe damage to our bodies. It gives us feedback to the environment. It keeps us safe. I jumped down 3 flights of stairs and my leg feels a little bit of pain. So I should not jump 6 flights of stairs. Or if something's hot and I touch it, it obviously is going to hurt and sting. So it's a very intelligent mechanism created by evolution to make sure our species can preserve itself.
So it's like a feedback.
It's a feedback, and it's very important to have a good relationship with pain, or at least to acknowledge that it exists. And what I tell a lot of the people that see me that work in front of the computer, it's really good feedback if you feel tight while you're in front of the computer to move around. So aside from like receiving chiropractic care, I really heavily emphasize on teaching people how to be aware of themselves and how to learn to reconnect with their body, because oftentimes when we're young, in fact all of us, we're told to sit down, be quiet, listen, and that happens from primary school, and within good reason, because we do need to create a literate society where people are educated and they can read and they can do a lot of the tasks that's essential for society to function. But the price that is paid is disconnection with the body, because what most kids want to do when they're young is move. They want to run. They want to play.
Especially children.
And school was only indoctrinated in the last 70 to 100 years. They made it mandatory. Prior to that, the only people that went to school were the rich people, and even then they went to school at a certain age, maybe around 8 or 10 years old. But once we became more developed technologically, we needed more skilled people. We needed an economy that can move, and we needed parents to be more free. So that another function of school is to allow mother and father to work, and that stimulates the economy.
I have a question from audience as well.
Yeah.
Before that, Jutin, you have something to say?
Yeah, I'm just saying that our audience actually can post their questions if they have any pain issues happening lately, or for a couple of months. So Dr. Theo will try to answer to that. We have one question here, but I have myself some questions as well, because I think being a practitioner, chiropractic practitioner in Europe and the Western country, and I think later on in Asia, and then later on at the later part you chosen Singapore. I think it's a very different group of people. So later on, maybe Dr. Theo can share with us like what's the difference, sickness, or the most common, pain problems that these three areas.
As well as people, is there any difference
Yeah.
in terms of culture or ethnic group that has difference in terms of your practice in a
Like the
sense?
Western or the
I mean,
Asian, and
if you look at
Singapore
a
itself.
place like America,
Mhm.
people tend to be more connected to themselves, how they feel, and there's a lot less familial pressure.
Mm.
Parents don't inject their beliefs on their kids as much, and they just allow their kids to do whatever they want.
More freedom.
And so the value of the self, of the individual, is a very strong part of American culture. And when people are able to be a little more selfish and go into themselves, they're more likely to discover their passions from it. But because of that, some of the people that get like they fall between the cracks, they feel very, very alone and isolated because they don't necessarily have people to fall on to. So the pressure of perhaps feeling lonely is a little stronger in American culture. And when I mean lonely, I mean very kind of unsettled kind, not like the one that I'm kind of depressed, but the one that I need to individually show personal strength. For myself, it's evident, and in Asian culture, it's kind of the opposite. I have to show on a strong face for my family, and I can't let my father down. I can't let my mother down. So these pressures do motivate people to work harder in Asia, because when you have so many people to please, or you have so many people you want to make proud, it's very hard to please everyone. But that's what drives people to work. So when I tell a lot of people, it's the story of their lives that actually is more important, especially when I see them. I'm interested in them as a person, and getting them to develop this kind of open conversation for themselves of, why are you sitting in front of a desk? And like I told you before the stream, a lot of it has to do with survival. People need to sit to earn a living. And there's not much people can change about it, because they can't just walk up and quit their job unless they made enough money. But what they could do is change their state of mind, how they perceive their lives. And if they can just sit in gratitude every single day, it will at least allow them to take a deep breath and feel some compassion for themselves. And one of the things they could do is also like go on some kind of walk every 20 minutes, just move around, and then just reflect maybe make it a ritual. You walk 3 or 4 times a day, and then that walk is just mindful gratitude.
So from the past 3 minutes, is that usually what the patients get from you when they see you? Because I think that's a very different kind
Yeah.
of concept.
Usually I listen to them. I ask them what's bothering them, and then I do talk about their pain directly, like their shoulder aches, and I ask them about their jobs, of whether they're sitting a lot, and usually they'll tell me their story. Sometimes they got it from exercising, sometimes they got it from sitting, and I do, depending what state they're in. If they're in a lot of acute pain, like they could hardly move, I'm just going to work on them. I'm not going to explain much because they're in higher need to be served and loved at that moment.
Yeah.
So I'll just make the conversation really short. Try to keep it under 3 minutes if possible. And then I just work on them. And then when I'm working on them, I'll just explain what I feel, and I'll ask them more about their history. So usually they open up once I start working on their bodies and checking. So.
And we have one audience here having a question. Nat, can you just share it?
Sure. So Jasmine say I have a sharp pain on the right leg, but I don't see any visible external injury, and it's not swelling as well, just very sharp pain.
It depends if the pain is localized. If I were to guess, and if it has to do with chiropractic, you have something called sciatica. There's basically a nerve that goes down your legs. It starts from the spinal cord, and then the spinal cord splits into two. Maybe you guys can find sciatic nerve on Google and then show a picture of it.
Sciatic. How do I spell that?
Sciatic, SCIATIC.
Okay, I found it. Sciatic nerve. Let me just find a picture of it. Okay, while you speak, I will just search for it and show it.
Yeah,
and
but
what
basically,
caused that, Dr. Theo?
It's sitting down.
That?
So on the topic of sitting at work.
You mean sitting down too long hour or too long?
Yes. Yeah, the nerve, that sciatic nerve, that's just at your buttock region is being compressed. That compression is done from sitting. It also gets hyper compressed through some kind of pelvic misalignment.
Okay, that's the sciatic nerve.
Yeah, can we zoom into it?
Okay, just give me a second. See whether I can. Yes, I can zoom into it. Yeah.
Yeah, just move up a bit. Move towards the pelvis.
Okay, this is a pelvis.
Yeah, there we go. Yeah, so we see there's the middle bone right here is the tailbone.
The tailbone.
Yeah,
okay.
And then you have your ilium, which is like your pelvic joint, and then you have this yellow nerve that's running through it.
Yep.
So when someone's sitting at work all the time, they're going to sit on that nerve right where the bone region is, where the line says sciatic nerve. That gets compressed. So an obvious solution is to get massage in the area, but also to get that area adjusted.
So what is your advice, Dr. Theo? How long should we sit? Then maybe we should just get up and move around, walk a little bit, rather than, some people, they just sit in front of the computer for,
I recommend every 20 minutes.
Every 20 minutes?
Yeah, I mean, if you look at human history, the oldest living fossil is 4.4 million years. So we've been walking on two legs for at least 4.4 million years. And for more than 4 million years, we've been walking, we've been moving. And only in the last, again, 50, 70 years, people are forced to sit down and they're not moving enough. And they're sitting on this nerve, which, chairs didn't exist for a long time too. So people squatted most of the time. The sciatic nerve wasn't compressed in the way that it's compressed now with chairs and sitting. So it's obviously not feasible to not sit if you have a desk job. But what you can do is, again, move every 20 minutes. Stretch your hamstrings, the muscle that is behind you at your thigh. You can stretch by touching your toes. And if that hamstring muscle is not as tight, it won't compress the nerve as much too.
And I
And
also
also
got
the
informations from,
yeah,
like some doctors, they will say that the older you get, it's better that you do more stretching.
yeah,
That's correct
yeah.
also?
It's pretty much important that you stretch all your life. In the most ideal circumstances, everyone should be able to touch their toes.
So if you are
Uh,
not able to touch your toes, I do have some students, because I
yeah,
teach vocal lessons, and I do some stretching exercise before the real singing start going, and some of them they can only reach maybe a little bit after their knee, the shin
yeah,
area. So that shows that they are not flexible enough, or they haven't been doing stretches enough.
yeah.
Some,
I mean that could be a big problem, and that could even a stretch like that
something
would
like
be fine.
stretching
Um,
something like that for the hamstring, right?
yeah,
Or you
yeah.
can
I
sit
would do
down
that.
as well. You can sit down.
I would do it sitting down and then trying to bend forward.
Okay.
You can find a picture of that, Nathaniel.
Okay,
Um,
let me just
Yeah,
try.
because like yoga, if yoga, there is still some uh, movements that you have to sit down and then touch your toe. It looks very simple, but a lot of people
yeah,
they couldn't touch their toe. The most they can go
yeah,
is to maybe their shin, and some
Something like
they
that.
can only touch their knees. This
yeah,
is one.
yeah,
And
Something like
try
that.
putting
Yeah.
yeah,
your two legs together. You'll
Mm.
feel the stretch underneath
yeah.
your knee.
Yeah, pretty much if you Google or go on YouTube and you look at any type of leg stretches,
Mm.
whatever you find, just do what you see on the YouTube. There's no muscle that cannot be overstretched. Most people are too tight because they're not moving enough.
Mm.
So
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 stretch,
what's
and I was just
that, that,
Dr. Teo's advice for Jasmine, besides not timing her sitting time, doing stretches?
uh-huh. Obviously to receive chiropractic care. Um, so I mean the other alternative is physical therapy or physiotherapy, because usually if your pain is at that state, it's probably something that's accumulative and
Yeah.
chronic. So it's something that should be addressed. Um, the worst case scenario that can happen if you don't take care of it is you develop a slip disc if you don't have it already.
a split disc.
Slip disc or disc
Yes.
hernia.
Oh,
That's when
okay.
the disc is resting onto the spinal cord.
Mm.
So there could be compression at the sciatic nerve, but there could also be compression much higher in the lower back. And if
Yeah.
there is a slip disc, then if it's so severe, the only option is surgery. And even then, surgery is not permanent. A lot of times it comes back. And pretty much all of health, when we're talking about maintaining and keeping well, once you do something good, you're not supposed to you're not supposed to stop. If I eat a salad once a week, I don't pat myself on the shoulder and say, "Oh, I ate a salad once, I'm healthy."
I
It,
mean, even when it comes to different type of pain, I've kept
yeah,
even for myself when I was doing psychotherapy work and counseling work, I've came
yeah,
across patient or client who actually experience extreme pain on the lower back, and
yeah,
it's actually related to their emotion, their anger, and by
yeah,
resolving their anger, the pain actually disappeared.
And actually,
yes,
that's what one of our audience posted. in Mandarin. Let me just read out that Chinese question, and then Dr. Theo, you can elaborate a little bit more about that. 钟明他提到的就是身心灵，有些时候呢是心理原因造成影响身体的疼痛，那只有心理的障碍解除之后才能康复。Now what Zhongming mentioned is about, what Nat have just mentioned. It's about emotional. It's just like, sometimes, especially like my mother, or they always, complain about, there's pain here and there, but they went to doctor, but doctor can't, diagnose anything. There's nothing wrong, but having the character of like very easily agitated or temperamental, very moody, mood swing kind of character, does that also cause pain?
Yeah,
in different body parts.
I have noticed different parts of the body representing different things. There's a correlation with like pelvic issues and self-expression or sexuality problems. With lower back, that has to do with more of like physical support. So if you're working in an environment and you don't feel like you have enough help, and you're doing the work of like 4 or 5 people, that feeling of lack of support plus sitting compounds and puts more stress on the spine. And neck generally has to do with belief systems. When someone has a certain thought, that causes them some discomfort or some suffering. Like, even the thought that why is everyone unkind? I can't stand unkind people.
Why is people
so
unkind
much.
to me? Why
Yes.
is people treating me like this?
Yes. So, not accepting what is a guaranteed point of suffering on any level.
Or unfair. Unfairness.
Not just unfair, but even something very personal, like I refuse to accept my parents living life like this or telling me to do this all the time. So when you're not accepting something within either yourself or specifically somebody, that's when the neck tension happens. Feeling cheated from somebody. How could they cheat on me? I did this, I did that, and this is what I get. I don't deserve it.
Why is your children doing this to you? Why is your husband doing this to you? Why is your boyfriend, girlfriend doing this to you?
Yeah.
That's why Dr. Kieu just now.
And then, if we look at eventually those thought patterns do create some kind of physical ailment. So just because we're telling people that emotions play a role in their physical suffering, it doesn't mean the body doesn't physically get damaged from it.
So when the subject is actually going through some emotional trauma, they actually surface as a physical pain. Is that right?
Yeah, it can.
Okay.
I believe that.
Yeah.
If you create pain in your mind, I think it's very logical that your physically you feel it as well.
Yeah. You don't want to go to school, primary school, you have a tummy ache.
Yeah. I mean, even if you're the most enlightened person, you're gonna age, you're gonna die, you can feel pain. That's just what we signed up for.
That's been
life is impermanent. It's supposed to be fragile. That's what makes us more enriched. It makes us appreciate every moment that we live.
I guess one of the key things is because you treat not just the muscle and the bones, but you also treat the problem. Because when the client comes in to see you, you have a lot of other stuff that is there. So while you're adjusting them, you help them to look into their emotional or your mental state that actually could be the root cause that caused the problem. Am I right?
Yeah, yeah, we can go as deep as we want to with that.
How far
That's
the
why
rabbit?
Dr.
Eventually,
Teoh stress a lot
eventually
on
you'll
finding the
start to
truth.
question. Eventually you'll question existence itself.
Hmm.
That's
Yeah.
why
Like,
Dr. Teoh
why
is a
is the
very
universe this way?
you want to know. You said you are one that actually seek the truth, right?
Hmm.
So I
Yeah,
guess the truth is always the true reason that actually leads to all this pain that
yes,
causes you to
yeah,
feel.
yes. And the short answer is to reach some sense of transcendence and enlightenment.
Hmm.
That's yeah, that's the only way.
Meditate more.
That's what
So
that's what I share with one of my students as well. It's so
yeah,
amazing that we shared that during our vocal lessons. I said, uh, finding the truth is one process, but after knowing the truth and to be able to accept the
Hmm.
truth, that's another process,
yeah, yep,
right? So you got to overcome both of it before you can really get some results or achieve what you hope for. And here we
yeah.
have one a viewer,
From
Alice.
okay. After operation, while recovery of tissue can cause the pain too. Some wounds, when recovered, can form a sticky form of substance that stick two or more tissue together that causes pain too. Is that right?
Yeah, I mean that's scar tissue. So
Mm.
when you get like a wound on your skin,
Mm-hmm.
um, if you look at the skin matrix looks irregular. It's very like disjointed. It looks kind of like duct tape. You know, when duct tape has like the grids going to
Mm-hmm.
the sides, that's like your body overbuilding tissue. And what tissues do when they first get injured is they overgrow or they overheal.
Mm.
So when
Let me
like
just
broken
show
bone,
show you one picture, and then Dr. Theo can further elaborate. That's a very nice picture for the past few months of my toe.
Oh, okay. Let me see. Let me just get a picture up while Doctor Teoh can talk. But in the
And
meantime,
that's
uh,
really what Dr. Theo have just said. Once you
yeah.
get when it's healing and you have that scar tissue, actually it goes up out of shape. That's what really happened to my toe, and
okay.
and it
Yeah,
shows in the picture.
yeah. On that note too, it's often said after surgery not to eat so much shellfish, seafood, because it interferes with the healing process.
Mm.
Is that true?
So, yeah, it's true. It's what you eat when you're healing counts. Like if you eat like fried chicken and inflammatory foods,
Mm-hmm.
then it's gonna increase the metabolism and inflammation in that area. And if that area
Inflammation.
is more inflamed,
Mm.
yeah, that's just why like
Ah,
omega
Mm.
3s fish oil is very popular because it puts our body in less inflammation.
Okay.
So again, like what I just mentioned earlier about rehab and getting movement, it's very important that our body has sufficient movement internally.
Mm.
So drinking lots of water, eating food that puts your body in less inflammation, like eating fish instead of beef, those things can aid in the tissue healing.
Okay.
And if you are having surgery in like an organ, um, getting the organs massaged can theoretically help. Of course, what I'm saying doesn't have, I don't think there's any scientific research that I know of,
Mm.
but just understanding physiology alone, um, some type of massage or something to increase the movement and circulation in the area should
Mm.
help the area heal faster.
Okay. That's the image of
okay.
feet.
Yeah. Yeah, so let's just pretend this person on the left bottom corner broke their toe. This kind of raised tissue is extra bone forming, and if it's not extra bone, then it's just increased swelling to increase the metabolism and to prevent something like infection from happening. So the body will release histamine to the area, and then that causes the capillaries to expand, to open up, and then that increases the blood flow. So one of the things that we're told, like when I was taking a physiotherapy module, was to put ice on it.
Ice, as in freezing ice.
Yes. But now there's research that shows doing nothing is better.
Doing nothing is better.
Yeah, just let the body heal itself. Don't move so much. So, there is a lag time to moving and not moving. So when the tissue does get damaged, it's wise to not move it for a few weeks. And then once you do feel like you can put some weight on it, that's when you start doing the massage, and that's when you start doing the stretches to heal that part better.
Dr. Theo, what Dr. Theo have just said is exactly what my physiotherapist have said, because he mentioned, actually you came to me at the right time, because if you came to me in the beginning, I can't do much to you as well, because the scar tissue is still forming up. You have to wait for the scar tissue to really settle down. Then you can start to, like what Dr. Theo said, and again, you can start maybe to massage it a little and to help it, but still I have to do it at home myself, some exercise, to move a little bit by bit. Yeah.
Now,
going deeper into Alice's question about the operation, and kind of piggybacking into the psychological effects of it, it's important to deal with whatever emotional trauma you may or may not have. And if you don't feel that you have it, try to go deeper into yourself to see if there's any residual emotions that can be stored. Because if like you had ovaries removed or something and you feel that a part of you is incomplete,
but sometimes it's very difficult for individuals to look deep into themselves.
Yeah, so that's when they'll see someone like Nathaniel or a psychotherapist or anybody that can allow them to feel safe and go into themselves.
Bingo. Yeah.
Earlier you mentioned about bone growth. I remember cases that I worked with before where subject has a bone spur grow on the feet.
Yeah.
Now, when we treat them in terms of emotional issue, where they are willing to let go of certain expectation from the parents and things like that, and the subject begins to come to term and look into acceptance, the life begins to change. And indirectly, the bones in the feet, the bone spurs actually disappeared. I'm not too sure whether is it physically able to disappear, but in their mind, in their perception, and when they go through their process, they don't feel the pain anymore. Is it true?
If it's depending on where the bone spur is, and depending on what is modulated by, if it's caused by some kind of inflammatory bone disease, like gout, stress can definitely amplify the symptoms of gout, and then you can feel the bone spurs are more elevated and more prominent. So maybe that's the best scientific physiological answer that I can come up with of why removing their perception of their stress can take out the foot pain. But if the bone spur is so severe, and it's protruding out, even if it's caused by gout or whatever, the only way to remove it is to shave the bone off. So it depends on where it is, how often. If it's at the heel, like a heel spur, that's very hard to remove because that's the bone that you're walking on every day. It takes so much pressure and stress. So
Correct. Yeah.
even if you've done the work, like the emotional work, and the problem is it's just been there for so long, you just have to do surgery on it.
Yep.
So it
And
depends
besides
on
that,
like
I guess.
where the person's at in their trauma, and whether it's manifested in their body long enough. If it's too long, then that's when you need some kind of medical intervention, and if not, some kind of physio or chiropractic care, depending on where the problem's at.
Now, Jade has a
Okay.
question. Will vegetarians heal slower due to their diet?
Yes, because protein is a building block, and when tissues break down, they need amino acids, which is
Mm.
from protein, to heal that tissue. So, if you are a vegetarian, it's very important to take some kind of protein shake,
Mm.
or if not, eat a lot of beans or eat a lot of vegetables that have enough protein.
Now,
So
I
what
have.
you can do is, look at your weight and
Yep.
look at how much protein you need a day. But I believe the estimates of daily protein is between 30 and 90 grams of protein a day,
Mm.
if I'm not mistaken. But anyways, you guys can look it up. If you're vegetarian, just make sure you're taking some kind of protein shake. Drink it like twice a day or something, and that should be sufficient.
Okay. The other
And that's
question.
also a lot of
Yep.
a lot of vegetarians do have osteoporosis. Their bone
Oh,
density
the bone
is
density.
less. Yeah, so getting that protein. Some people think calcium's enough, but you need calcium plus protein to build bone. In fact, even something like saliva has protein in it. So every tissue in your body, hair, whether it's hair or bone or heart tissue or saliva
Mm.
or skin, it needs protein.
Okay. Okay. All the viewers, do help us to like and share while we continue to look at some of the questions.
I think there's a
For example,
parent. Michelle asked a question that we skipped.
yes.
Okay. So let's look at Michelle. How does I can't let my parent down lead to a physiological problem?
Interesting.
Yeah. Well, the motivations of trying to please them leads to you working harder.
Mm.
So it's not like the thought of letting parents down leads to pain right away. It's the story that happens after that. Like
Mm.
when I graduate from school, I want to be a musician, but my father wants me to choose to be accountant, so I'm going to choose to be an accountant instead.
Mm.
And then once you become an accountant, and you're sitting down, you're listening to music, you're wishing that you made the music instead,
Mm.
but you're sitting in front of a computer. Um, that's what it can lead to.
Mm.
And what I always tell people is it's very hard to prove anything exists outside of you.
Mm.
It's a very radical idea,
Mm.
but somebody like Albert Einstein proved that time is relative.
Correct. Mm.
So what that means is, in some way or shape or form or the other, just by you existing and observing time, that you manipulate time to some degree.
Mm.
His equation, he didn't have enough evidence to prove that you create time, but he did have some proof that we influence time.
Mm.
But I believe if he found the equation, which he didn't because he died before he can find it, is time is created by the person.
Mm.
And this is a very radical idea because that basically means we render reality.
Mm. Correct.
and something that goes against all of what we're taught in school because we believe our parents made us. But if relativity goes all the way, then somehow you rendered and created your parents rather than your parents creating you. And I don't know what is true, what is not. My hunch is the individual renders reality. But let's say we are responsible for everything we create in our lives. What bad can that do? How much enriched and powerful and alive can we feel, knowing that our choices and our actions influence our environment on a very deep, profound level. So what I believe is there's no harm in thinking that, rather than the whole model that perhaps I'm just lucky to be here and I'm just a small piece of society, a small piece of reality. Because if that is true, whatever excuses you make, whatever thing you complain about with the government or anything in your life, you have no control over it.
External control psychology.
Yes. And that's not a healthy place to be in because the blame game is endless.
I still do
And
believe in like everyone just contribute in their own ability. Rather than
Yes.
thinking that I'm just a normal person, I'm just one and I can't do much.
Yeah.
And if everyone is thinking of that, then it wouldn't happen,
It's a very convenient lie.
right?
Yeah.
I
It's a
think
very
it's
easy,
sometimes come to
easy
an
trick
extent
people
it's an
use themselves.
excuse. It's an excuse like it's just one of two of us. No, you won't do any, you won't change anything.
Yeah.
And then you won't.
So
Yes.
we have one guest from from overseas who asked this question. I came in late, but has a good doctor discuss about frozen shoulders?
Very common.
Now,
Okay.
yeah. Well, let me just explain what a frozen shoulder is. Some people get confused because when they are talking about frozen shoulder, they're thinking that it's just tension here all the time.
Mm.
But officially, this is more of like a neck and cervical issue. When someone does suffer from anything along here, frozen shoulder happens in the rotator cuff, in this area right here. And what happens is when the capsule becomes inflamed, they start to lose range of motion. So instead of going here, maybe my shoulder will only go up to here and then it starts to cause pain. So if you do have a shoulder that is like that, then seeing a physio or someone like me that deals with frozen shoulders is prudent to go to. Most chiropractors don't deal with frozen shoulder to begin with because we specialize in the spine and adjusting or moving the vertebra. Sometimes just by helping people improve their posture is enough to take out the shoulder, a frozen shoulder. But if it's severe enough, then they might have to need to combine going to a physio and a chiropractor at the same time, or perhaps just a physio.
And don't forget to continue to stretch because that's what happened to me. I actually had a frozen shoulder when I was 49, but after going through from Google's and the YouTube, I realized that I cannot just, because I cannot lift up my shoulder, and then I just stopped everything. But I still continue to accept the pain, and then I do my stretches, all that. It's still painful, but you have to continue to slowly do it, and it sort of go off within about half a year.
So when you were
half
49, you had
49.
frozen shoulder. So at
because in
49,
Mandarin we call it 50间. Yes, they so call it. It's like you have it when you're reaching 50.
Okay. So
Or
at 49,
near 50.
yeah. So at 49, you have frozen shoulder. You feel like 94.
You can't even you can't even do your tie or whatever. You will feel very sharp pain, or it's just freeze. Your
Mm.
movement just freeze. That's why it's called frozen
Fro-
shoulder.
okay.
Yep,
That
it just freeze
does.
there.
I remember someone
You cannot
mentioned
go up.
also, in terms of frozen shoulder, does that also affects your tennis elbow? For those who don't play tennis at all.
A lot of people have tennis elbow, and
Mm.
it's generally not from tennis.
Mm.
Just by keeping your arms bent like this all the time and typing in front of a
Computer.
laptop, it's enough to give you froze in tennis elbow,
Okay.
because this is actually a stressful position for the joint. Same thing with your knees. When you're sitting and you're bending your knees, that actually puts a load on your knee.
Mm-hmm.
If you guys, if you can find the Da Vinci picture with the human body doing this,
Okay. Just give me find it.
yeah,
Okay.
that's actually an anatomical neutral position to be in. So if somehow you can, I don't sleep like this, but if somehow you can sleep with your arms straight and go on your back, that's actually a very neutral, good position to sleep in.
That's the best position, huh?
The worst position is curling up in a fetal position.
Fetal position. Okay.
Yeah, because that puts compression everywhere. Yeah,
Okay.
that
Is
one.
that the one? Okay.
So this is the best position.
Yeah, you don't necessarily have to have your arms spreaded, but if you do look at an infant, for example, they often sleep like this.
Who sleeps like that?
Infants,
I
babies.
I, I
A
saw
baby.
someone. I saw
A
someone.
baby.
Yeah,
Okay.
and the
Yes,
reason
yes, yes.
why an infant can sleep like that is because they don't have an ego yet.
Ah. Okay.
They don't have a thought, they just exist in a state of being. And the reason why they can exist at a state of being is because their parents take care of their survival.
Mm.
Okay,
Okay.
and one
And
last
often
question.
when children are not held, not feeling safe in early stage of their development, they die. So babies that aren't held die.
Mm.
They die pretty easily because they already know, if I'm not being held, I'm totally fucked. I'm totally screwed. Pardon my language. So
Okay.
as a way of preserving themselves, they don't live. So touch and connection is very important for our well-being. And
Okay.
unfortunately, we're becoming less and less in touch with each other, especially during this time where people are supposed to stay at home.
Mm. True. Okay. Now,
And
Chichen, you mentioned there's a question, right?
one
Is it from
last
Song
question from Zhong Ming. He mentioned about a lot of people is having knee problem, a kneecap problem, and that includes young people. So the age has been going down because we always thought that only the elderly person will be having the kneecap problem.
Yeah. Yeah, the knee is the most common place to develop arthritis in the body, because it's a heavily used part. So depending on the person's lifestyle, if they play a lot of like soccer or football, then that running and high velocity sport can cause injury at the knee. If it's more of the, like I said earlier, the sitting, certainly sitting will put a lot of pressure on your knees. So what you guys can do when you're sitting a lot is to straighten out your leg as you're sitting,
Straighten
or
out
even
the
bring up and stretch. Yeah.
Okay.
The downside, if you're sitting and you straighten out your leg, though, a lot of the weight and pressure goes to your lumbars.
Mm. Okay.
So if you do something, then it causes stress to another part, and if you don't do something, then it causes stress to another part. So it's really about balance, and again, moving around,
Yes,
stretching the
yes.
hamstrings. On the Going back to frozen shoulder, as a way to prevent frozen shoulder, stretch this pec minor a lot, this muscle along here.
Mhm.
What you can do is just hold like a a pole or the edge of a wall like this,
Uh,
something like this, and
okay.
just stretch like this. And you can just go up like this.
Mm,
Yeah, and anyone can do this. Even if you don't have shoulder issues, it doesn't hurt just to stretch yourself like this.
mm,
And just change the angle, stretch different parts of your chest muscle, your pectoralis muscles. And if you do that every day, it's a very easy remedy of preventing frozen shoulder,
mm.
because
So
it's not
start.
very pleasant to have a frozen shoulder. You can't change your shirt, you can't do a lot of things that you're used to doing. So
So start to
that,
do all your stretches every day, or at least about 3 days in a week.
yeah, I would say every
Plan
day.
your.
Yeah,
Every
You
you
do
day.
can,
every day.
yeah, like 10-15 minutes. And you
Mm,
don't have to do 10-15 minutes at once. You can just spend a good 5 minutes stretching a part of
Yeah.
your body.
mm.
And a way to prevent like neck, shoulder issues is to extend your neck every so often like this.
Okay.
Yeah, just extend, take a deep breath. When you take a deep breath, extend your lower back and extend your chest. Like open your whole body up like this.
Yep, and
That.
that helps with your double chin as well.
Yeah.
Yes, yes, yes. I do that.
Yeah.
You do this all the
It,
way, and then you do this
yeah.
Yeah.
all the way, and just do about a couple of times.
It,
That'll
it
be
helps
enough.
with double chin, but it doesn't help with my double belly.
For that part, you have to do something else.
Uh,
Okay.
Okay.
yep. So,
AD says she has 2 episodes of frozen shoulder. That means it recurs. Yes, so
Yeah, it's
it
just
does recurs.
it can. You just gotta keep stretching, and then
Yep.
on the emotional level, generally it has to do with feeling anger towards somebody,
mm,
like to the
okay.
point where you feel like you want to punch them in the face or something.
Wow.
That kind of
Okay.
anger.
Okay.
Yeah,
So by
and
resolving that
self-protect.
anger, the
This
frozen
is why
shoulder.
a lot of people like doing martial arts,
Ah,
and then
To
they
release the anger.
yeah, or what they have here in Singapore is a white collar boxing.
white collar boxing.
Yeah, there's an event where like office people can
Mm.
join this boxing competition,
Oh,
and then they box each other, and then it's like charity.
interesting. I didn't know
Yeah,
that. Wow.
yeah, they did it a few times in Singapore,
Okay.
and yeah, men and women do it.
I know the one that's
Boxing,
quite popular
yeah,
now that came out recently is one is throwing plates, the other one is throwing axe at the wall. So to exert the
yeah,
energy out at a target.
yeah. Those things can be therapeutic, but like I said earlier, it's important to process your emotions
Mm.
and look at them inside. And running's also really practiced. I mean, people pay to run to get motivated to run,
Mhm.
and when people get into it, they start producing like natural cocaine in their body. They call it runner's high,
Mhm.
and that's when they get really addicted to it. And some people end up running too much,
Yep.
like
That's
Yeah.
three,
right.
4 hours
So
at once.
just remember,
That's
don't
excessive.
overwork, don't
Yeah.
overdo it. Everything you have to strike a balance. You strike, yes, you can strike, but
Yeah.
strike a balance.
Yeah, the health risk of running too much is your body. If you don't have enough minerals in your body will start taking minerals away from your bone.
Mm.
Yes.
So that running will make you osteoporotic.
Mm.
And one of the components of muscle contraction is actually calcium. So
Mm.
every time your muscle contracts, you need potassium, calcium, magnesium in order to pump your muscle. So every year or so, some young man or woman, I think usually men, they do suffer from heart disease, like heart attack, when they're running. An otherwise healthy individual, they're running too much excessively, and then they develop a heart attack and die while running standard charter. So, how
That's
you look
because too much.
isn't, yeah, how you look and how you feel doesn't always reflect your health.
True.
So,
Okay,
moderation is
and
very important.
Yep.
Yeah, go ahead.
our
就这
time is running out. So thanks to
Thanks for
Dr.
My
Kieu,
pleasure.
and hopefully we'll have you again up in our program to talk about maybe not pain but other issues.
Yeah, sure.
how to dance like a chiropractor.
Yeah.
Anyway,
So you continue to enjoy your Chinese New Year.
Yeah, thanks for your time, everyone. I really appreciate you guys being here, and thanks for the opportunity to allow me to share to the public.
thanks for coming on our show. And like what one of our audience say, thanks Dr. Jim for sharing. And AD say, wise word, how you look and how you feel does not always reflect your health.
That will be the ending quote for the end of the program.
Yep. So thanks for coming, and we will see all our audiences next week at 10:30 a.m. on the Power Tree. Yeah. Thank you
Okay.
once again, Dr. Tia, for coming.
Thanks, everyone.
Okay.
OK，谢谢大家，新年快乐，拜拜。
Bye.
Bye.